Every year, millions of seniors walk into their doctor's office for routine checkups, confident they're doing the right thing. But what if I told you that some of those very tests, the ones meant to protect you, can quietly raise your risk of a stroke overnight? I know that sounds hard to believe. You trust your doctor. You follow every recommendation. Yet hidden in the fine print of modern medicine are risks that rarely make the headlines. Imagine leaving your appointment, feeling fine, and 2 days later you're dizzy, your vision blurs, or your words don't come out right. What happened? Today we'll uncover 5 common medical tests that may carry hidden stroke risks, especially after 60. And, more importantly, what you can do to stay safe. If you're over 60, type 1 in the comments. If not, type 0 and hit subscribe to Health 365, where we reveal what others won't tell you. Number 1. Test number 1. If you've ever had a CT scan with contrast, you probably remember that warm, flushed feeling spreading through your body. That's the contrast dye doing its job, helping doctors see your organs and blood vessels clearly. Sounds harmless, right? But here's what many seniors are never told. That small injection can quietly stress your heart and blood vessels, especially if you already have high blood pressure, heart disease, or kidney problems. For some, the dye triggers a vasovagal reaction, a sudden drop in heart rate and blood pressure. For others, it does the opposite, causing a spike that can tighten fragile vessels in the brain. A study in the Journal of Vascular and Interventional Radiology found that older adults who had contrast-enhanced CT scans experienced more vascular complications within 72 hours, particularly those with hypertension or kidney disease. Let me share one case. An 81-year-old man had a routine abdominal CT for mild digestive issues. The scan looked normal, but 2 days later, he had a minor stroke. Doctors believe the contrast injection temporarily spiked his blood pressure, causing a small clot. Does that mean CT scans are bad? Not at all. They save lives. The key is to use them wisely, only when truly necessary. Ask your doctor, is this scan essential, or could an ultrasound or non-contrast CT work instead? Always mention if you have kidney or heart issues or previous reactions to contrast. The right question can make all the difference. 310. Test number 2, treadmill stress test. Next, the exercise stress test, the one where you walk or jog on a treadmill while hooked to heart monitors. It's designed to test heart strength, but for some older adults, it can be risky. As the treadmill speeds up, your blood pressure and heart rate surge, sometimes beyond what fragile vessels can handle. In a 2020 study in the American Journal of Cardiology, nearly 7% of patients over 65 experienced adverse events during stress testing, including dangerous pressure spikes and irregular heartbeats. Take Margaret from Ohio. She was 74 with high blood pressure. Her doctor ordered a routine stress test. Halfway through, she grew dizzy and short of breath. They stopped immediately, but the next day, she suffered a minor stroke. The sudden surge in pressure likely ruptured a tiny vessel in her brain. Again, the test didn't cause the stroke, but it triggered stress her body wasn't ready for. What you can do. If your doctor suggests a stress test, ask, is there a safer way to evaluate my heart, like a nuclear stress test with medication or a resting echocardiogram? And if you have no chest pain or shortness of breath, discuss alternatives. Ask whether the test is even necessary right now. 510. Test number 3. Endoscopy with sedation. Endoscopies and colonoscopies are valuable diagnostic tools, but when sedation is added, they come with hidden risks for seniors. Sedatives naturally lower blood pressure and slow circulation. Combine that with common medications such as aspirin, Plavix, or warfarin, and you may have a recipe for trouble. A 2021 review in gastrointestinal endoscopy found a measurable rise in mini-strokes, transient ischemic attacks, within 72 hours of sedated procedures in adults 65 and older. One patient, a 76-year-old woman, had a routine colonoscopy. 2 days later, she began slurring her speech. Scans showed a mild stroke. Doctors suspected the temporary drop in blood pressure during sedation, combined with her blood thinner use, allowed a clot to travel to the brain. Before any endoscopy, ask, do I truly need this test right now? Can it be done without sedation or with lighter sedation? Do I need to stop my blood thinner first? These questions aren't being difficult, they're being smart. 640. Test number 4. MRI with contrast gadolinium. MRI scans are remarkable for detecting disease early. But when contrast dye is added, usually containing gadolinium, extra caution is required, particularly for those with aging kidneys. Your kidneys should flush the metal out. Yet after 60, kidney function slows, and if it's impaired, gadolinium can linger. Over time, it may contribute to a rare condition called nephrogenic systemic fibrosis, which hardens skin and connective tissue. More concerning, trace amounts have been found in brain tissue. Some researchers link this to temporary confusion, dizziness, and disorientation in seniors. A 2019 radiology study tracking 2,000 patients over 65 found that about 5% experienced stroke-like symptoms within a week of receiving contrast MRIs. Most had kidney impairment. Protect yourself. Ask if the scan can be done without contrast. If not, request a GFR blood test to check kidney function first. Tell your doctor about any past reactions to imaging dyes. The MRI itself isn't the problem. It's how your body handles the extra chemical. 810. Test number 5. Carotid artery ultrasound. Finally, the carotid ultrasound. A quick, painless scan of the neck arteries that feed your brain. It sounds perfectly safe, and it is, but the consequences of what comes next can be risky. If you have symptoms like dizziness, vision loss, or weakness, this test is important. But if you feel fine and it's ordered just to check, that harmless scan might lead you towards surgery you never needed. A major New England Journal of Medicine study following 3,000 seniors found that, for people without symptoms, carotid surgeries did not lower stroke risk significantly more than medications and lifestyle changes. And some patients actually suffered strokes during surgery itself. Helen, 82, from Pennsylvania, is one example. She felt healthy, but had a routine carotid scan showing 65% narrowing. Surgeons operated, and she had a small stroke during the procedure. She told me later, "I wish I'd known that doing nothing might have been safer." Before agreeing to any vascular procedure, ask, if we find narrowing, how will it change my treatment? Are there non-surgical ways to manage this? Monitoring with repeat scans and controlling blood pressure often protect you just as well. 940. Final takeaway. Not every test is dangerous, and not every test is necessary. After 60, our bodies react differently. What seems routine, a contrast dye, a sedative, or even a treadmill, can have ripple effects we don't see coming. A single injection might spike your blood pressure. A scan might tax your kidneys. A precautionary test could open the door to procedures that carry more risk than benefit. That's why awareness is your best medicine. Before any test, pause and ask, is this essential for me? Are there safer alternatives? You have every right to understand the benefits and the risks, because informed patients live longer, safer, and calmer lives. If you've ever felt strange after a medical test, or watched a loved one go through something unexpected, type 1 in the comments. If not, type 0 and share this video so others can learn too. And remember to subscribe to Health 365, where we ask the hard questions, uncover the hidden truths, and help you take control of your health, one smart choice at a time. 1040, closing line. Stay aware, stay informed, and stay well, because your health story deserves clarity, not surprises.